All right, hello everyone. Welcome to our next Sit and Sip series with Sam. So today we have Dr. Brandon Libby, who is a Umaine alum, and I'm going to let him introduce himself rather than me totally butchering it. So Brandon, if you want to just kind of introduce yourself, and then if you also kind of want to go a little bit into how you got into your career path, maybe your Umaine experience, and just all that fun stuff.
Sure. Well, Sam, thanks for inviting me to speak with the students and everybody. So I did graduate from University of Maine. I graduated in 2006. I'm actually a local. I'm local. I grew up in Brewer and went to University of Maine. And then after going to University of Maine, I ended up going to Dartmouth for medical school. And as far as how did I choose my kind of career path as going into medicine, I really liked the sciences in high school. I went to, I think it was the National Youth Leadership Forum on Medicine when I was a sophomore in high school. A few of us ended up going. It was a summer camp, and I really liked it. I got involved in being an EMT and actually was on UVAC on campus. And so I got to kind of have a little bit of firsthand experience with medicine. And then it just kind of naturally progressed that I wanted to go into medicine and ended up going to Dartmouth. I'm a practicing emergency medicine physician. So after Dartmouth, I went to Boston and I trained at Boston Medical Center, which is the largest trauma center in New England. We're a level 1 trauma center. And so I got some great experience there. I worked at Leahy Hospital for a couple of years after I graduated from residency at Boston Medical Center, and then I came up here to Bangor, and I'm currently working as an attending at Eastern Maine Medical Center. My choices to going into emergency medicine was not as easy as my choice of going into medicine. So there was a lot of things that I liked in medical school. I really liked all my rotations. I was thinking about going to surgery for a period of time, and ended up settling on emergency medicine, which when I go back and I think about it, I really liked being an EMT. And so I don't know if that kind of drew me back to that field with emergency medicine. But the thing that I like the most about emergency medicine is that we're diagnosticians. So people come into the emergency department, they don't really know what's going on, and we're really the first providers to diagnose a condition. And it's typically life-threatening, some of the life-threatening conditions. There's plenty of people that come in and it's not life-threatening, but I like the acuity that comes into the emergency department. I like how everything changes. So I like being surprised at what's coming in. I don't have a set schedule, so I never know how many patients I'm going to see in a day, and I never know if I'm going to be seeing heart attacks or strokes or broken bones. And it actually changes seasonally. So during, mud season, we have a lot of different four-wheeling accidents. In the summertime, we'll have lawnmower accidents. In the wintertime, it's skiing and snowmobiling and people falling through the ice. So, things definitely change seasonally. But I like that with emergency medicine, I can find it's applicable wherever. So if I'm on an airplane, somebody needs a doctor, I feel I can help them. If I'm out, doing something outdoors and somebody injures themselves, we can do things as far as wilderness medicine goes. That's a subspecialty within emergency medicine. So it's really applicable everywhere. And I kind of like that I'm a jack of all trades. So that's kind of what drew me to emergency medicine.
That's awesome. Emma or Ryan, do you have any questions? I'm just going to ask you guys throughout if you guys have questions for Brandon, because this is really for you guys. Not that I don't want to see Brandon, but I already know all the stuff. He's already bored me with this. No, I'm just kidding.
Same story.
Way to make it different. No.
Yeah.
Emma, did you have a question?
Yeah, I was kind of looking into ED utilization in Maine a couple years ago. I had an internship, and that was one of the topics that I got to explore. Yeah. I was curious a lot how our current situation has impacted utilization of the emergency departments that we may deem unnecessary, if you think it's increased or decreased, and maybe that's been kind of a positive thing.
Yeah, so that's a great question. So ED utilization is something we have definitely looked at before this whole pandemic, and then definitely currently in this pandemic. So before, ED utilization was something that we're focusing on because it indicates access to care. And so people that don't have access to care, don't have primary care physicians, don't have insurance, they end up tending to use emergency departments more because it's convenient, and they don't need to wait for an appointment. They can come right in, we can diagnose them. And a lot of times, we're the first point in the medical care that they've had. I mean, people come in, they haven't seen a physician for 20 years. And so we're the first point. So when we see, I would say, we can call it improper utilization, but it's not that they don't need to be seen. It's that we need to figure out how to give them better access to care. And so that's actually a project that we work on in the emergency department. We actually have case managers in the emergency department that we work on getting them a primary care physician. We work on getting them an appointment with a primary care physician within the next 7 days. And that's something that we've been doing for the past 3 years since I got there. It was a project that we were working on. Since the pandemic, we've actually had a decrease in total patient volume by 40%. Definitely people that were not using the emergency department properly aren't coming in. They're scared to come in. They're seeking alternative measures. We've actually increased telemedicine. And so that's actually, I think, is going to be something that's extremely beneficial after this pandemic is over, because instead of people driving 3 hours to go to a doctor's appointment, they can now just do a telemedicine visit, because we're the primary tertiary care center for more than 2/3 of Maine. And so the patients that are way up north at the tip of Maine, and they need to see a neurosurgeon, the closest neurosurgeon is in Bangor. So they would have to drive all the way down here for a neurosurgical appointment. And now they can just do a telemedicine. So if they had missed that neurosurgeon appointment and they needed to be seen by a neurosurgeon, they would come into the emergency department, because we would be the first connection for that neurosurgeon to come into the emergency department and see them. The issue is that because it's not just the people that don't need to be in the emergency department, it's across the board. So we're actually seeing people that have had heart attacks 2, 3, 4 days ago. People have had strokes 2, 3, 4 days ago. They're scared of coming into the emergency department because of this pandemic. And so people that we actually can intervene on, that are actually having emergencies, this pandemic has definitely hurt these individuals.
Any other questions, Emma?
I thought I was unmuted, but I wasn't. That's really interesting. Do you think this will lead to an increase in telemedicine utilization and, like you said, those patients that may not need to come into the hospital setting in particular?
Yeah, so I hope it leads to an increase in telemedicine utilization. So that's one thing that would be a huge benefit, because we can now extend our access of care. I think when it comes down to it, we want to make sure that we are able to give good care to everybody that is in need of the care. And so if people don't have a car, they can't get a ride, they can't make their appointments. A lot of times people aren't trying to be non-compliant. They get labeled as non-compliant, but really it's because they don't have the means of coming into the hospital. They don't have the means of getting to their appointments. And so with telemedicine, we can reach out to them. And I think it's going to be a huge benefit if they can continue that. And I hope that they can. The one thing that is going to be the kind of downside to all of this is billing and insurance. So the elephant in the room is always going to be how people are getting paid for this. And with the state of emergency, a lot of the regulations that was put on us by insurance companies have been thrown out. So we're allowed to bill for these services, whereas in the past, say somebody needs to see a cardiologist, if they can't listen to somebody's heart on the telemedicine conference, then they can't bill for the care that they're delivering. Now, people will argue, well, maybe we don't need to listen to their heart. Maybe I just need to check their blood pressure. Maybe we just need to talk about their arrhythmia and what their pacemaker is saying. So, I mean, we have a lot of things that we can do. We can interpret pacemakers over the phone. We can do all this stuff. But if, if we can't bill appropriately, and this is put on us by the insurance companies, then it's going to be hard for us to do the telemedicine. So there's going to have to be lobbying against the insurance companies and lobbying, against Medicare and the government to allow us to provide care via telemedicine.
Thank you. That's a really interesting point that, we don't think about because we're not there yet, but thank you.
So, because that is really interesting. And of course, I'm always like, I feel like this pandemic has made it very clear how much politics and finances and economics and all of that have such an impact on the field of medicine. And I feel like that we're kind of thrown into that. And a lot of times students don't realize that it's important until they're in there. They're like, oh, I'm living it. This is a huge deal.
Mm-hmm.
So because so many people have either gone on to unemployment or all these things, have you noticed there's been issues with patients paying for the services that they're getting? Because I know a lot of stuff like getting tested for COVID has been, I don't think they get charged or anything of that nature, but has that issue come up, like where you are trying to help those, but then they don't, because maybe that's why some of them aren't coming in, because they don't know how to pay, because they might have lost their insurance, because insurance is tied with a job, and there's all those other components that I feel like just make things way more interesting.
Yeah. So the emergency department is a very unique place. So we're governed by EMTALA regulations, where we need to provide emergency screening and emergency care regardless of how we accept money. So we actually provide the care and the patient ends up getting billed later. They do ask if they want to pay their copay, but it's also not required that they pay the copay. And so I'm not sure if it deters people from coming into the emergency department. There's also different pay scales that, because we're a nonprofit, we have to abide by. So if people fall below the poverty line or, 20% of the poverty line, there's different pay scales, and some of it is actually free. So we aren't billing for certain care depending on where they fall. I'm a little bit blinded by financials because I'm not in private practice. So people that are in private practice, they definitely are more attuned to that. And many times those physicians will take payment up front before seeing them. A lot of times that is for elective cases. So the people that are in plastic surgery, ear, nose, and throat. My wife is a ENT. She works for the hospital, but people that are private practice say that they need an elective sinus surgery. That's not something that is emergent that they need to have, but if they want to go to one of those private practices, then they might have to pay upfront prior to getting the surgery to make sure that the doctors are getting paid. And the reason why is because many of those private practices, they either have a surgical center, or we don't really have a lot of surgical centers. Down East Orthopedics is the only one that has a surgical center in the area, but they might have to operate at a hospital, and the hospital charges these private practices up front for overhead and utilization. So most of the bills that people get, if they actually look at them, a very small percentage is actually for the physician. All the other services are, they're called hospital fees, management, like overhead fees. And that accounts for, I would say like 70 to 80% of it. If any devices are implanted, things like that, that also gets taken out. So in the emergency department, we don't see the billing side. Sorry, it's kind of long-winded.
No, it was great and expected. No, I'm just kidding. Oh my gosh, baby, Parker!
Wow.
I was like, yay!
I am all for babies.
So
Yeah.
Emma wants to go into pediatrics, and so this is like up her
Oh.
alley.
Hi.
Say hi.
Parker?
Can you wave
Oh
to
my gosh,
Sam?
she's so cute.
And Emma, say hello.
Hi.
Do you
I
know
hope
that
you got a good nap.
Yeah, you got a good nap. Do you know that you went to class in Mama's belly? You did. Did you know
She
that?
did.
That's
Yeah.
awesome.
She did. When me and Brandon were teaching INT 200, she came in as a guest speaker.
That's amazing.
Yeah.
So you were like a guest speaker pretty much.
She was a guest speaker. Parker's like the most important guest speaker, let's be honest. She's like, yeah, that's cool, guys. All right, I'm still waking up from my nap. Oh my God, I love her.
She's adorable.
She's so cute. I can't believe she's almost 2. That's just crazy. And okay, so my next question for you, Brandon, is because I will not call you Dr. Libby. That seems weird.
No, that's fine. Yeah, no, call me Brandon, of course.
What, and I know you love this question, what advice would you give our pre-health students, those who are planning or applying soon, are preparing their application for health professions? What advice would you give them to make themselves the strongest applicant?
Yeah. So I think there's a few different things. One, I think getting some experience within the medical field and getting a good letter of recommendation from one of the physicians that you're precepting under. That's going to be something that the different medical schools will be looking at, and specifically say, you want to go to University of Vermont and you're precepting under somebody that graduated from University of Vermont. A lot of times, they have people that they know that are still at these different medical schools. And so having a connection and having somebody that can, say that you've shadowed them, you're interested, you have a good fund of knowledge, that's going to be, really important for these medical schools to see. Having a kind of a well-rounded application, so having say volunteer activities, something that you've done, volunteer, hobbies. Medical schools love knowing what people's hobbies are, because on paper they want something that stands out, and so it's great just talking about hobbies, things that you're interested in. If you love cooking, talk about cooking. If you are a competitive dancer, if you anything that you like, they want something that picks you out from the crowd, because the initial screening, it's going to be all on paper before they actually get to meet you in person and see how awesome you are. The other thing that I like to talk about is that when you're in college and you're choosing a major to go into, you don't have to be a biology major. You don't have to major in, I think it was, for biology, I think they said of the applicants, like 60 or 70% of the people major in biology. You have to do all the prerequisites, but if you're like super interested in engineering, if you're super interested in, astrology, psychology, I mean, like whatever you're super interested in, this may be the only time that you get to study something other than medicine. And so medical schools also like that. They like building a class with diversity. And so when there's 80% of people that are all biology majors, they actually look to stratify the class with people that have majored in different subjects. And so I was on the admissions committee for Dartmouth for a couple of years when I was there. And so I got to review the applications, and that was one of the things that we looked at. We look at, just things that kind of stand out, things that are unique. I remember there was somebody that had majored in classic piano, and it was just like a really cool thing, and that just caught our eye. And so I still remember reviewing that application. And so the things that when they stand out, you end up remembering those. And it's important to apply yourself. So even, in the classes, they're like, oh, this is just kind of a give me class. It's important to apply yourselves in those classes as well, because, if you don't and you end up having a grade that, is tainted a little bit, I mean, you can always get over, some grades that aren't great. I got, I didn't get all straight A's or 4.0s or whatever in undergrad, but you want to make sure if it's an easier class, you should definitely apply yourself, work hard, and grades aren't everything. I think the important thing to know is like making a well-rounded application, but it is important to have a decent GPA as well. Make sense?
No, it didn't make any sense. No,
Okay,
of course it made sense. Yes,
sorry.
of course it was perfect.
There's always like a really awkward pause because everybody's like on mute. I think I was like, oh, should I keep on talking?
No, you're doing great. Everything is just awkward whenever I'm around, so it's fine.
No,
it's all good. Emma, do you have any questions for Brandon?
Yeah, I think my only other questions would be, how do you think, again, the situation we're in will impact those that, I guess myself included, that are probably applying this summer? I know, for example, I am currently waitlisted and hoping to reapply just in case and get prepared, but do you think this will defer admissions or push back interviews?
Yeah, so that's a great question. I think that medical schools right now they're trying to scramble to figure that out. So I don't think that they know themselves what's going to happen. It's going to depend on what the situation is, and probably is going to be regionally specific. So if there are outbreaks in New York City that are continuing to, if the numbers are still high in New York City, I imagine the schools that are in New York City are not going to start classes on time. I mean, don't quote me on it, but they're either going to do it remotely, so it's going to be online initially, or they're going to have to delay their start date. Just because I think that they aren't going to want to expose everybody that are coming from outside the state. And also the instructors and teachers probably aren't going to want to get exposed either. So it's going to be interesting. I think that as far as, the volunteering and things like that, I think medical schools are going to be lenient because of what's going on. It's going to be hard to shadow and do the volunteering because of what's going on. So I imagine in the upcoming cycles, they're going to be more lenient as to what they're looking for. I imagine that some of the essays will probably include how COVID affected them.
Actually, yes. Actually, a lot of applications now, like ACOMAS and AMCAS, they have created a COVID-19 section.
Yeah.
That is optional, which I'm going to tell every student you need to fill that out.
100%. Anything that's optional is not really optional.
Right. But it gives you the chance to explain how has COVID-19 had an impact on your application. If there are certain things that are missing, that's a place to be able to incorporate that. So that's really good. So students are going to have an opportunity to explain themselves, not just in their essay, but there's actually going to be a whole part that is going to be able to go into that. But I mean, honestly, I think a lot of medical schools are also just trying to figure out, there's so many students whose rotations have gotten cut and haven't stopped. So they have to figure out, are they going to still do their rotations? Is that going to delay their, their years? Like, are they going to have to repeat? Are they going to move on? So there's a lot of that.
And it's kind of crazy because we need those students to graduate. We need them to be working. So that's a great point. I don't think that they know what's going to happen.
Right. And what stinks is for all of you who are going to be, applying is that unfortunately, I feel like you guys are kind of put on the back burner because they need to figure out the people who are currently at their medical schools right now or at their health professions program right now, because so many are just like hanging out, waiting. Like I did an info session with a PA school, and there was a second year PA student, and he was like, yeah. So I'm just hanging out. It's like I can't do my rotations. Like I can't, like he's just hanging out and doesn't know what's going to happen. And
Right.
like that's just so stressful that, it's already such a long process already. And now you might have to do an extra year. Or you might not get to your residency, right? It's like, it's crazy. And
Right.
what Brandon was saying is that I don't think medical schools really know, because you can't just do a cookie cutter, which makes it even more difficult. Is that, Tufts, Boston, like just if you think of the places that are so like city, small city, like, that whole thing is just it's going to take forever. It's going to be great.
Yeah.
And now there's murder hornets, and like, so
Oh
it's
my
just
goodness.
adding on to the whole, I'm
All
like
the
never going
time.
outside.
It's like
I'm
the
done.
plague. I mean, it's like, yeah, we're just going through like different stages. It's like, what's
People keep
next?
saying it's Jumanji. We're in the
Yeah,
game of Jumanji. Like
100%.
2020, you win. We get
Yeah,
it. All
yeah,
right. But
yeah,
it's like, who decided to name it a murder hornet? Like, that
yeah.
just sounds super warm and fine. Like, no.
I
I already
know.
told Christine, I was like, I'm out. I'm not going on. I'm staying home. I'm done. I'm done. I'm officially done, Christine. Oh, my goodness.
Yeah.
Um, so we are getting close to 4:30, but I know Emily. So Emily is another Umaine student who just joined us. Emily, Brandon, Emily.
Hey, how are you?
Um, so Emily, do you have any questions for Brandon as we're getting close to the end of our session?
No, I don't. I was just dropping in to listen. I was working and we
Oh gosh, yeah, no
in the
worries.
middle of something, so I was a little bit late.
It's all good. I recorded this,
yeah.
so you can listen to all of his awesome information and insight and his just geniusness later.
Okay, all right. What do you want?
Just
No,
joking.
I'm just kidding.
Nothing. What are you talking about? Oh my goodness. Goodness. Maybe there was a reason why we haven't seen each other so long.
What?
I'm kidding.
Cry.
This is the norm, guys. So this is all good. This is usually how we interact with each other. Okay, so I do have one more question for you, Brandon, before we finish.
Yeah.
What was your favorite experience at Umaine?
Oof, that is a great question. Man, so a lot of great experiences. I really liked the honors college. I thought that was a really good experience. The people that I met, I'm still good friends with today. And it was kind of like it was like a college within a college. So I mean, it's just a very unique learning experience. I enjoyed the small groups. I enjoyed the discussion. And I think that actually got me prepared for medical school, because medical school is a lot of small groups, and it's a lot of kind of reading journal articles and discussing in a group setting, similar to like how we used to review different pieces of work with the honors college, and then discuss it and critique it. And so I actually thought that really prepared me. Additionally, I was also involved in student government when I was at University of Maine. I thought that was a really fun and kind of good experience, kind of interacting with others and coming up with different plans and kind of a team building. And so I like the student government a lot. And then UVAC, the University Ambulance, was great. I spent a ton of time there, and it was a great group of people. A lot of the people that I actually worked with on the ambulance ended up going to medical school. And I think it probably just drew people that were interested in medicine. But I'm still friends with a lot of them. Laurel Parker, I worked with. She's actually an emergency physician down in Augusta. Andrea Pelletier, she's, I think she was OB-GYN. I can't remember, but she was involved. Alan Sherburne, I did residency with. He worked with me, and he's a general surgeon. And so it was a really good experience. So I definitely want to put in a good word about UVAC. If you guys are interested, I'm sure they're always accepting new people.
I don't think I've ever heard somebody call OBGYN OB-GYN.
Oh, yeah? Yeah.
Have you guys heard of that? And I was like, what? You have? And I was like, what the heck is OB-GYN?
No, I met with at OB-GYN and she kept using the term. That was the first time I'd ever heard it. And the first couple times she said, I didn't know what she was talking about. And I was like, here I am having this meeting with an obstetrician and I don't know what she's saying. And then it hit me.
Yep.
And that's a cool thing. It's a cool way to say it.
OB-GYN. Right? I was like, what? What are we talking about here? Okay, that's cool. That's awesome. I'm learning something today too. This is great.
Yeah.
Alrighty. So any last minute questions from Emma or Emily for Dr. Libby? All right, cool. Well, thank you so much, Brandon, for joining us and answering your questions. This was fantastic. I certainly learned quite a bit. So this will be recorded, guys, so I can send it to you if you guys wanted to look at it afterwards. And Brandon, I can send it to you too if you want to just watch yourself answer these lovely questions. I mean, obviously.
Oh, yeah. I'll be like, oh, God. I probably
That's fine. Oh, I do that all the time. I'm like, oh, did I say that? Great. Cool.
Yeah.
Emily, you get to see his daughter too. I'm going to send you the one. So his daughter made an appearance. It was fantastic.
Yeah.
All right. Well, thank you guys so much for joining. Have a good rest of your day and week. Good luck on any finals that you guys have left. You guys are going to crush it. And yeah, I'll talk to you guys all later.
Yeah. Good luck. If you guys have any questions, I mean, Samantha can give me my email. I'm always happy to reach out and talk to anybody. And it was great seeing you, Sam. And we'll have to keep in touch. Let me know if there's anything else that you need help with or anything.
Oh, I'm going to be teaching class INT 200 is now going to be two credit courses. So I will definitely be, I know. So I will be hitting you up soon to be a guest speaker.
Yeah. Awesome.
Yay.
That's good.
Okay. Awesome. All right. Bye, guys.
Thank you.
Thanks. Bye.